Feeding tubes are used as a source of nutrition for those that have difficulty or are unable to chew or swallow. Goals of feeding tubes include nutritional and weight maintenance and improvement, quality of life improvement, and a feeding tube can potentially be used as a trial run to determine if a long-term feeding tube is needed. Conditions that may require feeding tubes include, but are not limited to, strokes, CP, upper motor neuron and lower motor neuron lesions, and dementia. Tests to determine if a patient may need a feeding tube include, but once again are not limited to, a swallow study, an upper or lower GI test with a barium swallow, or an abdominal ultrasound. Parents may notice that their children do not eat, which may indicate some complication in the mouth, esophagus, or stomach of the child. Initially, an NG tube is placed in a patient, running through the nasal passage and passing into the stomach. However, this is only used for a maximum of 30 days. If needed, a G tube or a J tube will be placed on a more permanent basis. A G tube goes directly into the stomach, and a J tube goes directly into the jejunum. A J tube is primarily used if a patient does not tolerate feeding into the stomach.
T-Bone was the king of these streets. Robbery, drug dealing, protection rackets, balloon animals. He walked a hard life, a life that was about to be changed forever, as this king was about to be dethroned.
It's a beautiful day at 7-Eleven. My tasty sandwich. Hey, sir, how can I help you?
Put the money in the bag, old man.
Put the money.
Yeah.
What?
Sandwich too.
No.
Yeah. I eat what I want when I want. Only through my mouth hole.
That's really specific. Hey, well, okay.
Yep.
I hope you can turn your life around, sir. Aw, come on. Just
Good day to you.
Dr. Digestion and Nurse Rex Mulberry are meeting at the nurse's station to discuss T-Bone's best plan of care.
Patient's chart, Test Teton, aka T-Bone, male, age 24, TBI due to blunt force trauma. Since he's unconscious and can't swallow, I'm gonna have to decide what type of feeding tube I'll use. You know, an NG tube would be good to use if I expect him to be able to swallow on his own after about 30 days.
Whatever will you do, Dr. Digestion?
Well, Nurse Rex Mulberry, he may not recover in that time. And Rancho Level 4 patients also tend to pull out their NG tubes. So I'm thinking a PEG tube is the most appropriate.
I'm sorry, I'm new and not a really good nurse. Is a peg tube like inserting a peg into his mouth?
Well, Nurse Mulberry, not at all. PEG stands for Percutaneous Endoscopic Gastronomy. Let me sing a song to help you understand. The feeding is always better when the tube goes right in the stomach. We'll light up the stomach to see it better. Nurse Mulberry, give that light switch a flip. Just look at the light right through the stomach. Right here in the operating room. The tube will hang out of the abdomen. What more is you going to do?
I'll elevate the bed to at least 45 degrees. Keep them there for at least an hour. That feeding is a breeze. Make sure the tube stays clean and dry. Feed them at meal times or else they'll die. Flush out the tube before and after feeding to avoid food buildup.
For nutritional needs less than 30 days, an NG tube is inserted through the nose into the stomach. It passes through the nasal passage, down the esophagus, and is inserted into the stomach via an endoscopy. This can be rather uncomfortable and irritating for the patient, which can cause reflux and gagging. Patients also tend to grab at NG tubes, and an NG tube must be changed every 3 days to 4 weeks. It can clog quite easily depending on what is being ingested through the NG tube. During an NG tube feeding, the head of the bed needs to be at least 30 degrees during the actual feeding and then for 30 to 60 minutes after the feeding. For nutritional needs greater than 30 days, an endoscope-guided tube is directly placed into the stomach, called a G-tube. This is surgically implanted. Gastrostomy tube is the most common type of feeding tube. There's 3 mechanisms of placement for a G-tube: endoscopically, surgical laparoscopy, and surgery using a larger incision for children with any sort of structural abnormalities. A G-tube is more comfortable than an NG tube for the patient, and this is primarily used for long-term use. Types of G-tubes include PEG and long tubes, which are often used as the initial G-tube for the first 8 to 12 weeks post-surgery, and then a low-profile tube, or also called a button. This mechanism is placed on the abdominal wall and directly inserts into the stomach. There is no long tube hanging out of the stomach with a low-profile tube or a button. When not in use, the button lies relatively flat against the body. This is much more discreet than a PEG tube. There are 2 different ways to feed if you have a G-tube. The first way is through gravity, in which the feeding bag is above the patient and a new bag is replaced every 24 hours. The second option is through a syringe. The syringe is connected to the button and is filled with a bolus of food. The bolus of food is inserted directly into the G-tube extension. For patients with a button, this must be replaced anywhere from every 3 to 12 months, depending on the type of G-tube, and this can be done by the caregiver. The site must be cleaned with soapy water 1 to 3 times a day. A PEG tube is made from flexible polyurethane and is approximately 35 centimeters in length. PEG tubes are held in the stomach with a retention bumper that lies against the anterior gastric wall. The patient must sit upright at least 45 degrees during PEG tube feedings and for at least 1 hour following feedings. Red flags to look out for post-surgery include severe pain not relieved by non-opioid painkillers, or if the pain is worse by using the tube, fresh bleeding, gastric fluid, or feed leaking from the wound site. But keep in mind a small amount of bleeding from the site is expected post-surgery. Sudden change in general clinical observations, and a change in behavior or level of responsiveness.
Ability to successfully swallow and eat. A permanent feeding tube is needed for T-Bone. Unfortunately, feedings through his G-tube have not been tolerated by his stomach. He went in for surgery again to remove the G-tube and have a J-tube inserted. The J-tube was placed directly in the jejunum through a similar procedure as a PEG tube, which used an endoscope to view proper placement in the jejunum. T-Bone has regained consciousness and has been successfully feeding through his J-tube for the past 5 days. The doctor and the nurse are discussing discharge plans with him now.
Good morning, T-Bones. You're going home today.
Yay.
We're going to teach you how to manage your new J-tube.
Your feeding is going to need to be continuous feeding still once you are at home. If we were to give you boluses of food like we did for your PEG tube that you had at first, you would end up with a lot of abdominal pain and diarrhea, and we don't want that.
How do I know? Or how do I do that?
Well, you'll get an enteral feeding pump that will regulate your food intake. You'll need to check when each bottle is finished and then add a new bottle when your current one runs out. Make sure as well that you're flushing out your feeding tube with sterile water at each bottle change and before and after feeding. Here, Nurse Mulberry will show you.
Here, it's this easy. We'll just take a bottle of water. Sterile water runs through this to flush out any food that was left in there to keep it from getting dirty. And now we'll hook up a new food bottle.
That does seem pretty easy.
All right. Well, you'll need to make sure that you get your J-tube replaced every 6 to 12 months. Just make sure to check your tube so that it to tell that it hasn't moved, and also don't rest like your pant waistline or belts or anything on that tube site. If you decide that you have any questions after discharge, feel free to call your primary care physician and they'll be able to help you out.
Cool. Thanks for the help. I don't think I have any questions.
Good luck to you, T-Bone. Stay well.
Appreciate it.
A J-tube is placed directly into the jejunum as opposed to the stomach. A J-tube is not usually an initial option for feeding tube placement. Rather, it is used when there are anatomical problems with the stomach that do not allow for entry of food, or in cases such as aspiration or regurgitation. A J-tube is placed using a similar technique for a G-tube or a PEG. It can be placed using an endoscopy or a surgical incision laparoscopy, and it can also be placed by using a gastric bypass procedure. However, this is a more difficult surgery and is not used as frequently. Care is similar to G-tubes, but J-tubes have a tendency to leak more, and they also may lead to more irritation around the site. For maintenance for the J-tube, the patient needs to clean the site 1 to 3 times a day, and also continuous feeding over an 18 to 24 hour period each day is required to avoid abdominal pain and diarrhea.
Since his injury, T-Bone has become a reformed man. He's changed, and he wants to prove it. He goes back to the gas station to see the attendant Joe Mo to make amends.
Hey, I don't want any trouble.
No, I'm sorry. I want to apologize for the person I was. I've changed. We should bond over some tea and maybe a sandwich.
What? That's very kind of you. But there's no sandwich for you.
No.
What will you eat?
I've got mine right here.
Oh!